All right, flu season is upon us, and some of these numbers, when you hear them, I don't know if it's the worst ever, but man, it's scary stuff when better than 60 kids die across the country, otherwise very healthy adults. To family physician, Dr. Jen Caudle, on why it seems to be so bad. Doctor, what's going on here?
There's a lot going on. And Neil, I really liked what you said going before the break, which is that if you haven't bothered to get your flu shot yet, you really should bother. And you're right about the numbers. So it's not too late, right, Doctor?
Oh my Explain
gosh.
Why not?
It's not too late. Remember, flu season technically goes from October to May.
To May?
Yes. The height of the flu season is usually December to February. We have weeks and weeks and weeks to go, people. We are not done yet. The CDC thinks that the numbers will still climb. You need to get your flu shot if you haven't. But to your point, Neil, one of the things we know is that the rates of influenza-like illnesses that we have now have reached what we had in 2009 during the H1N1 pandemic. So
Wow.
we do have more cases. This is a severe season.
You know, this might not be your area, Doctor. I apologize, because it seemed to be a financial issue for this one woman in Texas who died, whose husband later said they couldn't afford the $160 copay on the flu vaccine, I guess Tamiflu. Do you hear cases like this a lot, or are those sort of outliers?
No, and sometimes it does happen. What you're talking about with Tamiflu, it's actually an antiviral. It's not a vaccine, so it's an antiviral that helps reduce the symptoms of the flu once you've gotten the virus. What's really important to keep a note, and you mentioned this, yes, sometimes people do run into cost issues, but I don't want this to deter you. We sometimes have run into some shortages of Tamiflu in different parts of the country, but this is not widespread. This is what I say. If you don't feel like you can afford the medication, if you're having a hard time finding the medication, I want you to call around, I want you to ask around, call your doctor and see if there's anything else that can be done. It's very important.
Now, the way it's going so far, Doctor, I mean, how do you advise patients handling this? Let's say you got it, and then that whether you had the shot or not, what do you do?
Okay, so this is the thing. I mean, flu season symptoms, right? You got the cough, runny nose, the high fever, muscle aches and pains. You feel like you've been hit by a bus. Most people will probably do okay on their own, but the people we worry about are people with very severe symptoms. You're not getting better. Or people that are very young, those who are older over the age of 65, pregnant women, or those with chronic medical conditions. You guys really need to be seeing your doctor. And, you know, this is a word I have for everyone else out there. I'm seeing a lot of people not coughing into their elbow, not using a tissue to cover the mouth. Please be careful. Wash your hands, disinfect surfaces, get that flu shot. It's so important.
You know, do you think we've gone too far in that regard? The people are very now leery of shaking hands, period. I mean, they're getting really nervous about this. Or is that justifiable?
It's honestly, I think it's justifiable. Honestly, you try to shake my hand, sometimes also I'll try to like give you a fist bump instead, or a peace sign, or like I do that with people. It's really important. Or if you shake hands, just go to the bathroom, wash your hands afterwards, or use some hand sanitizer. It is not overrated. This is how virus particles are transmitted. Is we get them on our hands, we touch our face, and we can become ill. It's not overrated.
Well put. And you practice and you preach, doctors. I saw you in the green room before, and you just waved to me. That was fine.
It's like from across the room.
Exactly. Don't even come close to me. All right, Doctor, thank you very, very much. The Dow up 72 points right now. We'll have more to this.